map from the CDC shows 0 counties in Massachusetts at low risk now for COVID-19. Here to answer your questions is Dr. Emily Heil, an infectious disease specialist at Mass General. Thanks so much for being with us, Doctor.
Hello.
All right, doctor, so you can see on the map, we'll put it on the screen here, that every county right now is either medium risk, that's the yellow areas, or high risk, red. So how concerned are you about our current trends?
So, the cases are definitely rising. And I think that this is a reflection of the different variants of concern where past infection and having been vaccinated or having a booster really matter. So, for instance, we are seeing some people who have been infected recently with Omicron still becoming infected with the new variant, BA.2. And additionally, the real impact of potentially having boosters. So although our vaccination rates are very high in the state, and that's excellent, our booster rates are much lower, 50% among most people and only 75% among those over than 65. So I do think that there's more that we can do. And I also think wearing a mask inside can be really helpful in terms of reducing your risk of exposure.
Well, so Doctor, in part, you already answered my next question, which has to do with we are highly vaccinated here in Massachusetts, but we are still seeing rates going up. So in terms of us becoming a hotspot again, is it more because the vaccines don't really prevent getting infected? They just prevent you from being hospitalized, hopefully?
So we are seeing that there is a decay or a decline in the protection from vaccines for getting any infection over time. That's why a booster can be helpful, or a second booster for those who are eligible. But we have seen that the vaccines continue to be really excellent to prevent hospitalizations and death at a very, very high effectiveness. So I think the vaccines are working very, very well. I do encourage people to get a booster shot, especially that first booster shot if they haven't already of any age. But then also to have additional protections in place for people who are at risk for serious disease or who want to avoid infection entirely, potentially with wearing masks or spending time outside if you're gathering with others.
All right, so another area that you might say we're at high risk for right now is tree pollen. So anybody who might be allergic to tree pollen certainly will know for sure after this weekend. Look at that, there's our weather graphic, high, very high for the next several days. We don't have a lot of rain in the forecast either, which usually helps. So someone with seasonal allergies, should they develop congestion, that's obviously a common symptom of allergies, do they need to take a COVID test, or can they wait maybe for some other symptoms, sore throat, fever, those kinds of things? What do you recommend?
That's a really important question. I would strongly recommend anybody who has any symptoms of any kind to test themselves for COVID right now, given the amount of community transmission that we are seeing. So as you said, the symptoms can be very, very similar to allergies, seasonal allergies, which are high now, and they really can be indistinguishable. So even though COVID can have additional symptoms, it can be as mild as just some congestion. So to protect those who you encounter and spend time with, it's really important to test. Additionally, for people who are at really high risk for serious disease, it's important to test so that you can become eligible for outpatient treatments to prevent serious infection or progression to hospitalization.